Good morning. I'm Dr. Carol Fox, the Chief Medical Officer for Excella Health.
And I'm Michael Sekhon, the Director of Pharmacy for Excella Health. And we're going to go through a number of questions that some of the community members have had regarding the COVID-19 vaccine. So we're going to go back and forth, and I'll go ahead and start. How soon after you get the second dose of the vaccine do you have immunity? So 14 days.
The next question is, what are the main differences between the various vaccines? So actually, we'll start with some similarities. Each of the vaccines decrease the likelihood of hospitalization and death. Johnson & Johnson is a single-dose vaccine, whereas Pfizer and Moderna each require 2 doses. The Pfizer vaccine's doses are 21 days apart, and the Moderna vaccine's doses are 28 days apart. Pfizer and Moderna are mRNA vaccines. mRNA teaches cells how to make a protein that triggers an immune response. Johnson & Johnson uses an inactive virus to deliver a gene that carries the blueprint for the spiky protein on the surface of the coronavirus, which then triggers that immune response.
So how long after you have been diagnosed with COVID are you no longer contagious? The times have varied from over 2 weeks to 2 weeks and then less than 2 weeks. Now, this is a really good question because it has changed as the course of the virus has been studied and more information has become available. So I don't want to say that each of those times when they were presented were necessarily wrong. At the current time, based on our current knowledge of the virus and studies, we're saying 10 days is when you are no longer contagious from symptom onset.
The next question is, I read in an AARP bulletin that it's best to avoid fever-reducing medication prior to or even after receiving the vaccine, as it may inhibit some degree of immune response. However, AARP is the only place that I've seen that. Do we have any guidance on that issue? There's really nothing specific noted for any of these vaccines regarding the use of antipyretics, but it's not likely that they would impact efficacy. However, it is important to note that there are some childhood vaccines for which this has been studied, and they do suggest avoiding the use of antipyretics for several hours after dosing. But to be clear, this has not been tested with any of the COVID vaccines. What I would suggest is that if you do not need to take anything, I would not, and if you do, be sure not to exceed normal doses.
So some staff have elected to receive the vaccine, but are concerned not knowing for sure if the second shot will be available or when it will be scheduled. So over the last few weeks, that has been a major concern as there have been more people wanting the vaccine than vaccine available. Good news is the vaccine supply is catching up with demand, but it is important to note that you should be getting the first vaccine, even if you can't be 100% sure that you'll be getting the second vaccine in a timely fashion. The first vaccine will impart some immunity to you, maybe not the full immunity for both doses together, but will offer some protection, so the sooner you can get it, the better.
The next question is, does the vaccine alter your DNA, and is it a live dose of the virus? None of these vaccines alter your DNA, and none uses live viruses.
So next question is, what are the differences between the first and second doses? And will this be a vaccine that requires a booster shot years later? So in of themselves, the vaccines are exactly the same. So if you're getting Moderna, you will receive the exact same vaccination for your second dose as the first. As Dr. Fox mentioned, if we're comparing Pfizer to Moderna, the time frame is a little bit different. Now, in regards to a booster, unfortunately, we don't know 100% if a booster will be necessary or not. With some of the new variants coming out, it seems the correct answer is likely.
If someone has received both vaccines, can they still transmit the COVID virus to others? Is it safe for people who have been vaccinated to attend small social gatherings again? Should people who have been vaccinated still wear a mask and practice social distancing? We do not know with certainty whether or not fully vaccinated individuals can pass on the coronavirus to someone else. The testing that was done initially was designed to determine if individuals who received the vaccine became symptomatic or not, and if they did, if they required hospitalization or if they died. The testing really did not look at whether or not they could pass the virus to others. Therefore, we recommend that if you have received the vaccine and others have not, that you continue to wear masks and social distance, other than the recent information that came forward from the CDC that did suggest that you could potentially be around a limited number of non-vaccinated individuals without a mask, provided that they are not high risk of serious illness. Unless you're certain that the individuals that you are around are not at high risk, I would strongly encourage you to continue to wear a mask and to continue to practice social distancing.
All right, so the next question is there truth that people with heart stents may not be a good candidate to receive the vaccine, and people with type A blood may have difficulties? So as we've been rolling out the vaccine across our country, it has been tightly tracked in regards to the adverse events and effects that have been occurring. Now, in regards to the heart stents, there has been no data that has been released that suggests that someone with a heart stent should not get the vaccine. In fact, patients with cardiac issues are part of the group that are recommended to get the vaccine. Now, early on during the actual pandemic, not the vaccination process, persons with type A blood were found to perhaps be more susceptible to the virus. And I believe that's where that question is coming from. However, again, with the vaccination process, there have not been events reported, particularly in patients with type A blood.
Can an employer or school force their staff or students to get vaccinated? An employer or a school cannot force their staff or their students to get vaccinated at this time. There is some pending legislation in Congress intended to address this issue, but at this point in time, no one can force you to get a vaccine.
So will the vaccine ever be safe for children and pregnant women? So the short answer to that question is likely yes. However, when any new drug comes to the market, there weren't a lot of vulnerable populations included in those studies, such as pregnant women and children. This is no different with the COVID vaccination. So as studies become more robust and include more vulnerable populations, pregnant women and children will be included. It's for that reason that right now, children less than the age of 16 and pregnant women are not necessarily recommended to get the vaccine. Any pregnant woman should consult their obstetrician before getting the vaccine themselves.
Are you able to elaborate on post-vaccination COVID exposure protocols and guidelines? Individuals are considered to be fully vaccinated 14 days after their final dose of vaccine or after the single dose of the Johnson & Johnson vaccine. At this time, because it's still relatively early, the recommendation is to assume that you are immune from serious illness for at least 90 days after vaccination. As we learn more, it is likely that this timeline will be extended, but at this point, you would not be required to quarantine if you have a known exposure within those 90 days. If you're not sure, it's always best to speak with your primary care physician.
So last question we have on our sheet today is, my questions would be, what is the best advice for someone that has had multiple allergic reactions to vaccines previously in their life? Is one vaccine safer than the other, or have less risk of someone having a reaction? So of the 3 vaccines currently on the market, the Johnson & Johnson, the Moderna, and the Pfizer, no one is safer than the other in regards to anaphylaxis. The general recommendation is if you've had a reaction to any of those vaccines or a component of those vaccines in the past, you should not get one. If you are unsure if you are allergic to one of those components or have had a lot of issues with vaccines in the past, definitely the recommendation is to talk to your physician and figure out that risk benefit there. There may be a reason why you should get it, and there may be a reason why you should not, but that's a decision you have to make with your physician.
Thank you very much for having us today. As you might imagine, information is very rapidly changing regarding the coronavirus. Therefore, if you have additional questions, please refer to our website, www.excellahealth.org, or to cdc.gov or to health.pa.gov for the latest information. And again, thank you very much.